I'm having some fun today. This recent TikTok post and the comments to that post is one of the reasons I decided to get back into posting relevant information about back pain to dispel so many myths and misinformation that there is out there. Check it out.
Before I'm allowed to get an MRI, I have to go do 4 weeks of physical therapy. They sent me to X-ray. They know that I have L1, L2 situations that require MRI to get a better look. But yet we're going to take 4 weeks, send me to expensive physical therapy before I can go get the test I need. I'm going to go to ProScan, out-of-pocket pay for an MRI, and physical therapy. Anybody out there doing this?
Now, some of the comments that I read to that post, it just had me scratching my head. They didn't make any sense. I'm going to read just a few of them, and I'll do a more detailed explanation in another video. So here's one. As an MRI tech, I'll never understand the philosophy of let's treat you with PT before we do a 20-minute test to see what is actually wrong. That's wrong. In very rare situations will the MRI actually make or confirm the diagnosis. More often than not, in most people, the MRI is going to show an abnormality that may have absolutely nothing to do with the pain experienced and lead someone down the wrong pathway for more expensive and aggressive care. Here's another comment. Sending someone for PT before a proper diagnosis is made is a wild take. Well, that's a wild take by whoever made that comment. As I've mentioned before, and you've heard me say this, the MRI does not make the diagnosis. Sometimes it's a part of the equation, but more often than not, the exact part of the low back causing the pain cannot be 100% accurately identified with confidence, and the MRI often only adds to that confusion. Now let me see another one here, and I'll look for it. Oh, on the flip side, PT without a complete set of information can ruin your world. As I said earlier, an MRI, when it's really not needed, can ruin your world, and I will also talk about that in another video where it's shown that MRIs in many situations lead to a great deal of fear and fear of movement that actually harms the patient. Anyway, this lady who wanted an MRI and the comments that followed that were completely off the mark, and this is just one example of the abundance of misinformation that you're going to see when you're looking at various social media sites. So please, if you want more good information, follow me on my Spine Guide channel or TikTok or YouTube. You can also reach out to me and direct message me with any questions you have. I'd be happy to answer them. Thanks a lot.